Thank you. Good morning, you guys. My name is Stephen Furmanek. I am a data analyst in our clinical research support program, and we are available to help as well, so shameless plug. So I'm going to start out this presentation with a story. So this is a clinician and researcher, like many of you all. And she's noticed that several of her patients who've taken levofloxacin have developed Clostridium difficile. And so, like many research ideas and research questions, she saw just a pattern in her patients and decided, hey, maybe there's an association. So now she begins to look at other cases of C. diff within her hospital. So she wants to look retrospectively, but she doesn't know how many cases she should include. This is just the first of potentially many statistical issues she'll have. So she begins to think about sample size and realizes that there's a lot to this. She has to think of the cases and controls, how many different variables do I want to put into my equation? Am I doing a sample size for one group or two? Is this going to be paired or independent samples? So there are many, many issues. But then she realizes it's not too late. I can call my statistician, and they can help. And her conclusion was that since I involved my statistician before I collected data, my research will be better and just stronger research. So in clinical research, it's important to involve your statistician early in study design and planning. There are several statistical issues that could pop up. There could be issues in data collection that you don't even realize that your statistician could point out. Sample size, of course, is a big one, and that will be the focus of our presentation today. If you are doing a randomized controlled trial, then they can help you out with randomization. And then data analysis as well, they can help you out there. So there's many, many different issues that could come up. And so to continue with sample size, your sample size calculation varies pretty greatly depending on what type of study you want to do. If you're doing a quality or performance improvement project, usually you will use events or time periods as your sample. Clinical research, you're going to use patients, but there's also many different types of studies. These are just two of them, as we've discussed today. So in performance and improvement, even here, it's highly dependent on what you're measuring and what you want to show. If you have rare outcomes, you probably want to look at your events, and you want to have a pretty good number of events. I will actually get more into this later in our quality improvement stats lecture going on, but that there are also common outcomes which run charts or SPC charts, as we mentioned earlier today, the statistical process control charts, those as well. Depending on your sample size, you can use different charts. So what we really are going to highlight in this presentation is sample size in clinical research. And so the sample size calculation has four main components. There are pretty much as many sample size formulas as there are types of studies. So for brevity, we won't get into all of them. But the four main components are your effect size, what you're measuring, your variance/standard deviation, and then your type 1 and 2 error rate. So sample size calculation, as I said, requires a formula that is really best handled by a statistician. You may not be using the right formula if you try and calculate it on your own, or there could be something better you could be doing. The statistician has expertise in this. This is what he went to school for, so you should let them take care of it. As a researcher or clinician, the two most important things for you to bring to a statistician are your effect size, which is what you expect the results of your study to be, and your variance and standard deviation, and how much you expect those results to vary. And so we're going to continue looking at the research topic of antibiotic use in C. diff. And so for this study, you can think of two groups. You have the group that got your antibiotics and the group that didn't get your antibiotics. So you have your treatment and control, per se. So your effect size would be the smallest difference between your study groups that you would think is clinically significant. So you can see there are multiple types of effect size. You can have a big effect size, small effect size, and that will change depending on how many people you will need. So if we were to look at examples in this, say you had two outcomes that you were looking at. You were looking at just the rate that they got, the rate of C. diff infection and the length of stay. So your rate would be a difference of proportions. So your effect size, if you expect 30% of your people who got antibiotics to get C. diff, which hopefully you don't, but if you have that and you expect about 20% in the group that didn't get antibiotics, your effect size would be 10%. And likewise, if your group that got antibiotics, their length of stay was 7 days, the group without, their length of stay was 4 days, your effect size would be 3 days. So you're really just looking at the difference of what you expect your two groups to be there. Now, this may come as kind of confusing because if you're trying to research the difference between two groups, you may not know what your effect size is going to be because that's why you're researching it. So you can utilize data from pilot studies. You can find effect sizes in literature for similar topics. Or you can take an educated guess, which that is, unless you are an expert in your field, not your guess necessarily, but someone who knows that they're an expert on it. So going back to the big and small effect size, a larger effect size requires more people, or excuse me, a smaller effect size requires more people. As you can see, with a difference of 15%, there's only 118 per group, whereas if you change it to 5%, it requires almost 10 times as much. So mathematically speaking, you can actually get any effect size if you have enough people based on the sample size formula. So if you wanted to look at a 1% difference, you would need roughly 32,000 people per group. So you can find statistically speaking, you can find any effect size. You just may need to enroll the world's population twice. So the point here is not that what effect size do we want, it's what effect size is clinically significant, what marks what would be just a good clinical difference in outcomes. So moving on to variance. For continuous measures, you have to worry about the variability of what you're measuring. For proportions, this is actually rolled into the sample size formula based on the proportions that you're expecting. So you actually don't need to worry about variance if you're measuring proportions or rates. But if you're measuring things like length of stay and you're using a continuous measure, you would want to think about this too. And the true variability of things is pretty much never known. Usually, at best, we can estimate it. So you would want to look at samples or pilot studies, do a literature search, or you could also get an expert's opinion. And again, large variance requires a larger sample size. A small variance requires a smaller sample size. So looking at length of stay, if your standard deviation is 12 days, you're going to need almost 9 times as many people than if your standard deviation is 3 times less. So there's a potentially big difference of a group, or based on how variable it is. Now, there are a few other considerations to think about for sample size besides just those, but this is more looking at kind of what you plan on measuring in the long term. There is what's considered the 10-to-1 rule, and the 10-to-1 rule dictates that you should only look at one variable per 10 people in the group of the lowest outcome. So instead of looking at the treatment and control, now you'd be thinking in terms of whether or not they developed C. diff or not. But what it's saying is that if you have, say, 20 patients that ended up getting C. diff in your sample, then you could adjust potentially for, say, age or race or something else. Whereas if you had 50 patients with C. diff and they were the smallest group, say you had 150 without, then you could look at potentially up to 5 things. So it could be age, race, socioeconomic status, several other things. So if you plan on doing a lot of in-depth like modeling or things like that, you should know that if your sample size projected you have is 22 people, you probably want to look at more. And so the sample size is important because your study might not find a significant result because you enrolled too few people, and not because there's no association. So that is one thing to consider. You could also overpower your study and do the opposite, where you find an association where there is none, which is also a possibility. But that is much less likely to happen than you to have too few people. So some other considerations. Your sample size calculation is only as good as the values you give your statistician. So obtaining appropriate estimates for your effect size and standard deviations is critical. That's why you don't want to take a wild guess. You would want to get an expert's opinion, or you'd want to look at several pieces of literature to try and find it out. And so if you improperly estimate it, it can and very likely will lead to error. And speaking of error, what about the types of error? You don't need to distress over these. Typically, they're set before the study goes on. There's type 1 error and type 2 error. Usually, type 1 error is set to be 5%. The p is less than 0.05. It's the same standard there. And your type 2 error is usually set to be 20%, so that you have 80% power for your study. So unless you plan on changing things up from the clinical research norm, those are usually always the same. And so the takeaway today is that you should involve your statistician early. You should have an idea of what the effect size of your research is going to be, and you should have an idea of how variable what you're measuring is. And that way, when you consult a statistician over sample size, you can really work with them most efficiently and also just well. All right. So here are some credits for the pictures.
Yeah,